Drink some cold water and then I will give you banana pudding for dessert, Mommy said, getting her a sandwich to eat. Thanks, Mommy, this will wash down those stewed prunes, Charlie said. I would prefer to eat adult food. All the soft baby food, formula, and water have given Charlene more bowel movements than normal. After lunch, Charlene is put back in the crib again. It is not long before she messes her diaper with soft poop like a baby does. Charlene drifts off to sleep before telling Mommy. In a couple hours, Mommy comes in the nursery to check on Charlene. She barely notices the poopy smell but realizes Charlene needs changing again. Charlene is woke up, at the same time she suddenly pees her diaper. Charlene remembers she messed the diaper earlier. Mommy, I need changing again and go to the bathroom more often, Charlene said, wanting out of the wet messy diaper. Get used to this, sweetie, Doris said nicely. Mommy is here to take care of you and change your diapers. Charlene is carried from the crib to the diaper table again. Mommy changes her like an expert. Charlene is wearing a nice, comfortable, clean diaper and locked back in her crib in her pink nightgown. She can rest for a few hours until the next diaper change is needed. Part 6. Today is Thursday, the 4th day of June in the year 1995. On Monday night, little Charlie fell out of bed at 4 a.m., which was early on Tuesday. He was taken to see his female pediatrician Dr. Cindy Brown at 9 a.m. Tuesday morning. Charlie has bruises along with sprain injuries from his fall out of bed. Things could have been worse. Dr. Cindy Brown remembered Charlie falling out of bed as a toddler and having to sleep in a crib longer than normal. For Charlie's safety, she sent a crib to his home and insists Charlie start sleeping in a crib again. Dr. Brown included diapers since Charlie will be sleeping in the crib with the sides up. A diaper table was included with his crib. To Mother Doris's surprise, other items are delivered to her home which are paid for by her health insurance. Little Charlie, who is 5 feet 2 inches tall and weighs only 80 pounds at age 19, is shocked by the delivery. Dr. Brown included plastic baby panties with a full case of 96 6-tape disposable youth-size diapers which are very thick. Charlie had been getting away with being naughty. This included lack of effort to get a job, sitting home, being lazy all day, bad manners, and a bad attitude. Dr. Brown, after hearing complaints from Charlie's mother, concluded he should be punished. She provided Mommy Doris with the extra items for this reason. Doris figured Charlie deserved punishment and she made Charlie into a toddler girl named Baby Charlene. The additional items Dr. Brown had delivered included a high chair, playpen, little girl's clothing, baby bottles, pacifiers, baby formula, and diapering supplies like diaper rash cream and baby powder. Charlie about freaked out when he saw all this stuff for him. The crib alone was bad enough, he understood it would be safer to sleep in. He is shocked to be diapered not only every night but during the day too. The doctor ordered him to have a few days of rest in the crib for his injuries. Mom gladly applied diaper punishment and petticoat punishment. Yesterday Charlie woke up and is given a bath to remove all body hair and feminize Charlie as Charlene. He was dressed in a girl's nightgown along with diapers and plastic pants. Charlene was confined to her crib for the day. She wet and messed her diaper several times Wednesday. A new day has just begun on Thursday. This will be the last day of needed bed rest and pain medication for Charlie. He wakes at 8 a.m. to Mommy coming into the nursery. She knows Charlie will need a diaper change right away. Mommy picks up Charlene from the crib and lays her on the diaper table. You will have to stay off your feet and rest again today, Mommy said. I will change your diaper and you can remain in your nightgown. Yes, Mommy, I hope tomorrow I can walk and get exercise again, little Charlene replied. You should stop diapering me during the day. You know that is not going to happen, Charlene, Mommy insisted. I am keeping you in diapers as baby Charlene for at least 1 year to punish you for your bad behavior since graduating high school. Wow. Once again Charlie as Charlene realizes Mommy is serious about this. She is cleaned up before diaper rash cream and baby powder are used. Mommy lifts her by the ankles and slips a clean diaper in place. The diaper is brought up between her legs and taped on snugly. Pink plastic rumba panties are put on Charlene that match her nightgown. Mommy washed and dried those yesterday. Charlie as Charlene is embarrassed by this baby girl treatment with diapers. He is not able to stop mother from doing this and easily picked up and overpowered if needed. Mommy Doris loves the change and having a regressed adult male back in diapers as a little girl. Okay Charlene, as soon as I brush your hair and fix you ponytails we can have breakfast, Mommy said. Today we are having instant oatmeal. Charlene's hair is brushed neatly and put in 2 ponytails with a pink ribbon tied around them. Charlie looks just like a little toddler girl. Mommy carries him to the kitchen and places Charlene in her high chair with a bib around her neck. Charlene gets a baby bottle of warm formula first while water boils for the oatmeal. I have fixed 2 bowls of oatmeal with apples and cinnamon, Mommy said. One is for me and the other I will feed to you. Mommy puts Charlene's baby bottle on the food tray and begins to spoon feed baby Charlene her oatmeal. This takes about 5 minutes and Mommy has a seat to eat breakfast. Charlene finishes her bottle and is given a pain pill. This helps keep her pain-free and a bit drowsy. Time to put you back in the crib, sweetie, Mommy said, getting Charlene out of her high chair after wiping her mouth clean. Mommy carries baby Charlene to the nursery and locks her safely in her crib. The high sides make it very confining. Charlene has a pink teddy bear. Mommy put a pink pacifier in Charlene's mouth and will be back shortly with a baby bottle of cold water. Mommy cleans the kitchen and takes time to pay a few bills by mail. Here Charlene, drink up your cold water before resting again, Mommy said, handing the baby bottle to Charlene. Yes Mommy, but all this liquid will cause me to wet my diaper, Charlene said. Soft food is making me mess my diaper too. No worries honey, Mommy is here to change your diapers, she said. Charlene is diaper changed before lunch and fed baby food in the high chair. She is spoon-fed creamed corn with ham along with stewed prunes. Charlene is back in the crib for the afternoon. I will check on you again before supper at 6 p.m, Mommy Doris said. Just before 6 p.m. Charlene is found to have a wet and messy diaper that needs changing. Mommy carries her to the diaper table and does another expert diaper change. In her high chair Charlene is fed creamed peas and yellow squash. The last pain pill is given to Charlene. Drink up your baby bottle of water and you are going back in the crib, Mommy insisted. Tomorrow you can be up during the day. Charlene is a little drowsy as Mommy locks her in the crib again. She falls asleep until about 9 p.m. when Charlene calls Mommy for another diaper change. Mommy takes care of this, but this is the last diaper change until morning. Charlene is back in her crib. She wet and messes her diaper by the time morning arrives. Baby Charlene, it is time to get you up and in a clean diaper, Mommy said, smiling as she entered the nursery. Charlene is picked up out of her crib and placed on the diaper table. Her nightgown is removed, then her pink plastic rumba panties. Mommy untapes and disposes of a wet and messy diaper. Charlene is cleaned with toilet paper and then baby wipes. I will give you another bath this evening, Mommy said as she rubbed in diaper rash cream and baby powder on Charlene's diaper area. Today I am putting you in a pretty pink sundress with a lovely white petticoat. You will look adorable. This does not please Charlie, who is forced to be Charlene. Her clean diaper is taped on snugly and milky white plastic panties are put on. Mommy puts a pair of white tights on Charlene. The silky and soft white nylon full petticoat is put on Charlene. The pink sundress is next and they both fit perfectly. Pink lacy socks are put on Charlene's feet and her hair is redone in perfect ponytails. Go ahead and walk, sweetie, and take a look in the mirror, Doris said. Part 7. After looking in a full-length mirror, Charlie is stunned at how much he looks like the little girl Charlene. Mommy has dressed him for the day and Charlene can walk around and get exercise again. Charlene is not stiff and sore anymore and making a good recovery from her fall out of bed at 4 a.m. Tuesday morning. Today is Friday the 5th of June. I must get pictures of you in this outfit, Mommy said. Let me apply a bit of makeup first. Pink lip gloss is put on Charlene along with a bit of blush on the cheeks. Mommy takes several pictures to add to the ones she took secretly. She has pictures of Charlene sleeping in her crib wearing the pink nightgown. A few pictures show her pink romper panties clearly over a thick diaper. More pictures will be taken to make a baby photo album. I hope you adjust to your new situation of being baby Charlene, Mommy said. Nothing will change for at least 1 year. If you are allowed to be Charlie again after a year or so, you will still sleep diapered in your crib. Potty training will not occur before then. Mommy is showing no letting up on her extended punishment. She no longer cares that Charlie is unemployed as long as he is baby Charlene. Maybe after a year or so he can be potty trained and given a chance to act mature like any 19-year-old male should. Charlene has a doctor's appointment on Monday with her pediatrician. When we see Dr. Cindy Brown again, I will order a case of diapers be delivered every 2 weeks, Mommy said, and more plastic panties. Charlene is fully feminized and wearing her pink sundress. She has on a thick diaper, milky white plastic panties, white tights, and pink socks. Charlene is dressed in shiny black strap shoes. After breakfast, a short walk outside will provide Charlene with needed exercise. Mommy, I don't want to go outside in diapers as a little girl, she said. You are going to anyway and the neighbors will not know who you are. I want to see that you can walk okay after your fall. I made some cream of wheat hot cereal to feed you for breakfast. Charlene is put in her high chair with a bib on to protect her dress. Over your lips and past your gums, open up baby, here it comes, Mommy said, teasing Charlene as she feeds her. A baby bottle of cold water is fixed to go with the meal. Charlene drinks that while Mommy eats and does dishes. Charlene is glad to get out of her high chair and walks fine around the house. It will be embarrassing for Charlie to go outside as Charlene. Neighbors will wonder who this little girl is and where is Charlie. Okay baby, we are ready to go out front and take a short walk, Mommy said, grabbing Charlene by her hand. Out the front door they go with Charlie dressed like a toddler girl. He hopes not to have to speak to anyone. It is 10 a.m. on a sunny warm day outside of Macon, Georgia in the suburbs. No one appears to be out as Mommy and little girl take a walk to the end of their short street. Little Charlene is walking well after a few days of resting. They turn around and head back toward home on the same side of the street. About halfway back, Miss Julie Carter comes outside to say hello. She is friends with Doris and knows little Charlie. Charlene tells Mommy to keep on walking. She instead waits to talk to her friend. Hello Doris, I see you are out getting some exercise, Julie said. Who is this cute little girl you are with? It's a long story, but this cute little girl is Charlie, who is now Charlene, Doris said, embarrassing Charlie. No, it can't be Charlie, he is too rough and tough to be a girl, Julie said. This little girl could not possibly be Charlie. Julie looks closer at his face and notices they are the same size. Oh my goodness, that is your son Charlie. What did he do to deserve this punishment? He graduated from high school well over a year ago and never found a job, Doris said. Charlie laid around the house all day being lazy. He had a bad attitude and bad behavior, Doris explains while thinking. His punishment began after Charlie fell out of bed and the doctor sent a crib for him to sleep in, Doris continued. She gave me diapers, a crib and little girl's clothes. I am sorry to hear Charlie fell out of bed and a crib makes good sense, Julie stated. I hope he was not injured badly. Charlie went to the doctor and appears to be fine after a few days of crib rest, Doris explained. He was diapered the whole time. It sounds like he deserves the little girl punishment to me, Julie said. I can see his diaper makes the short dress flare out. Are you keeping him in diapers as a little girl? Yes, Julie, I plan on doing this for at least 1 year and see how it goes after that, Doris said. I guess everyone will eventually find out. Charlene is stunned to have Mommy give him away as Charlie. This is the last thing he wanted to happen. Julie will likely tell others about this. Mommy flips up Charlene's sundress to show her plastic panties and diaper under the tights. Charlie is red in the face and wants to leave. He has not said anything. You sure are pretty as Charlene, Julie said. This punishment must be embarrassing for an adult male that is small like you are. Yes ma'am, I could do without being punished this way, Charlene said. Mommy is not giving me any choice about this. Nice to see you again Julie, Doris said. We need to continue our walk and go back inside where it is cooler. If you need a babysitter let me know, Julie said teasing Charlene. I can change diapers. Charlene is glad they are leaving and anxious to get back in the house. Charlie's new situation as Charlene is no longer a secret. Julie went inside and called a couple of lady friends on the street. Charlene has not been in the playpen yet, so Mommy puts her in there. It is a big playpen with high sides making it impossible to step out of. Mommy has some chores to do and turns on the television. Captain Kangaroo is on and then Bugs Bunny for Charlene to watch. She will not be watching adult programming anymore. In the playpen Charlene wets her diaper after about an hour. Mommy is busy doing the laundry. Mommy. I wet my diaper and need changing, hollers Charlene. Okay sweetie, but I am folding some clothes, Mommy hollered back. After finishing the laundry Mommy comes to get Charlene out of the playpen. She is lifted up and carried to the nursery. Her pretty dress and petticoat are taken off before Charlene is laid on the diaper table. Mommy takes her tights off next and then plastic panties. A wet diaper is removed and disposed of. Charlene is cleaned with baby wipes. I will have you in a fresh clean diaper in a jiffy, Mommy said, rubbing in diaper rash cream and sprinkling baby powder on Charlene. Charlene is lifted by the ankles and a clean diaper is slid in place. Mommy pulls it up between her legs and tapes it on tight. The plastic panties are put back on and the tights. Charlene stands to have her petticoat and dress put back on. Okay sweetie, have fun around the house for a while, Mommy said. Part 8, Friday evening. Charlene is given another warm bubble bath and her hair is washed with baby shampoo. Mommy wet combs her hair and dries Charlene with a large soft towel that is pink. Charlene is taken to the diaper table in her nursery and put back in a diaper. This time Mommy dresses her in yellow plastic panties. A yellow nightgown similar to the pink one is put on Charlene for overnight. Mommy, I want to watch television before going to bed later, Charlene said. Not children's programming please. You are a child as my little girl and no adult shows are allowed, Mommy said. Charlene is allowed to watch the Disney Channel until 9 p.m. when Mommy insists it is bedtime. Still in a clean diaper, Charlene is taken to the nursery and put to bed in her crib. Mommy returns with a baby bottle of warm formula and Charlene nurses it down. Have a good night's rest, Mommy is glad you are all right now after your nasty fall out of bed the other night, Doris said, leaving the nursery. The entire weekend is spent with Charlene being diaper changed as needed and eating baby food meals in her high chair. Mommy has her wearing various dresses, onuses, and even a skirt and girl's t-shirt. Charlene always sleeps diapered in her crib with a nightgown on. Mommy bathes Charlene every evening and washes her hair. It is always blown dry and put in 2 pigtails on each side of her head. During the day Charlene has light makeup applied with her outfits. No one has stopped by to visit, but Doris got a few unexpected phone calls. Julie gossiped to a few of the neighbors and they called Doris to find out if this story about Charlie being Charlene is true. Doris politely explained the situation to her friends and got approval from them for her discipline of lazy little Charlie as baby Charlene. Moving ahead in the story, it is Monday morning, the 8th day of June. Charlie has a follow-up doctor's appointment with Dr. Cindy Brown, who is a pediatrician. She wants to make sure Charlie recovered from his fall out of bed last week. Mommy gets Charlie, who is Charlene, up and out of her crib at 8 a.m. The doctor's appointment is at 9 a.m. Wake up, Charlene. You have a doctor's appointment in an hour, Mommy said, getting her out of the crib and on the diaper table. Charlene was bathed before bed last night and her hair washed. This morning Mommy removes a wet diaper and cleans Charlene up nicely. A clean 10-6 tape disposable diaper is put on Charlene. Pink plastic rumba panties are put on Charlene. They have 5 rows of white lace across the backside. Charlene is dressed in a petticoat and fancy pink dress that is clean and ready to wear. Let me redo the ponytails in your hair with fresh pink ribbon, Mommy said, taking care of this. Pink lip gloss is applied to Charlene's lips and blush on her cheeks. A pair of white lacy top socks are put on Charlene and black strap shoes. Mommy has a diaper bag packed and they will have breakfast at a local restaurant after the doctor's appointment. You look real pretty as Charlene, Mommy said. I want Dr. Black to see you as a little toddler girl. I would rather she saw me again as Charlie, Charlene said. I don't wish to be a toddler girl. Mommy could not help but giggle about this. Dr. Brown had a lot to do with Charlie becoming Charlene. By 8:30 they leave the house in Doris's car, which is almost brand new. Mommy has the diaper bag in the car. Good morning, Doris, Nurse Dolene said. Is this little Charlie? Yes, this is Charlie as Charlene, my little toddler girl still in diapers, Doris explained to the nurse. He is very pretty as Charlene and I bet Dr. Black will love seeing her, Nurse Dolene said. Have a seat and I will take you back in a minute. A few minutes later Mommy and Charlene are seated in the exam room waiting for Dr. Brown. She walks in to see a cute little girl instead of Charlie. Doris points out that her name is Charlene for the records. Little Charlie, you sure have changed in 1 week, Dr. Brown said, smiling at Charlie. You are adorable as Charlene, sweetie. Tell Dr. Brown thank you for the compliment and for all the nice things she had delivered to our home, Doris insisted, looking at Charlene. Thank you, doctor, for the compliment and all the stuff you sent to my house, including my crib so I don't fall out of bed, Charlene said nicely. You did a wonderful job of making Charlie into Charlene, Dr. Brown said. I already see he is more polite and obedient. Mommy removes Charlene's dress and petticoat so Charlene can be examined. The doctor looks her over and finds all the bruises are gone. Charlene moves well and shows no sign of any lingering injuries. Dr. Brown giggled seeing Charlie in a diaper and plastic panties. Charlene is redressed again and walked back to the waiting room. She has a lollipop for being so good. Dr. Cindy Black wants to speak to Mom in her office. The nurse will keep an eye on Charlene. They are the first patient of the day again this week. I took care of the things we talked about over the phone on Friday, Dr. Black said as they chat in her office. Charlene is on record as 5 years old and still in diapers. I obtained a birth certificate for her. You are amazing, Dr. Black, and thank you for helping out, Doris said. The medical records now show Doris has a daughter age 5 instead of a son age 19. They show Charlie is no longer a patient because he left town to go live with his father. A change of identity is successful and things will stay this way. Thanks for the new birth certificate, Doris said. I now have proof that I have a 5-year-old girl to raise. Yes, ma'am, it was my pleasure to make the change permanent, Dr. Brown responded. I will have that case of diapers delivered every 2 weeks like you requested. New plastic panties will be included. Charlie is in the waiting room and not aware of his permanent identity change. Mommy will break this to him gently when the time comes. Doris returns to the waiting room so Dr. Brown can see the next patient. The small family goes back to the car and to the restaurant. If your diaper is wet I can change you in the ladies' room, Doris said. Yes, Mommy, I wet myself in the waiting room, Charlene admitted. At the small diner Mommy and Charlene are seated at a table. The hostess tells Doris there is a diaper changing table in the ladies' room. Mommy and Charlene go there with the diaper bag in hand. The toddler diaper table pulls down from the wall where it is mounted. Charlene is small enough to use it safely. Charlene's dress and petticoat are removed and put on a hanger. Mommy picks up Charlene and places her on the changing table. Her plastic romper panties are removed and so is a wet diaper. Suddenly the waitress comes in to ask if Doris wants hot coffee. She looks and sees this little toddler girl has a penis. Charlene blushed badly. "Excuse me ma'am," Misty said, "did you want a cup of hot coffee?" "Yes thank you, bring some milk for a baby bottle," Doris said. Epilogue: At the restaurant the family has returned to their table. Doris has hot coffee and the milk is put in Charlene's baby bottle. Mommy orders scrambled eggs with ham and cheese for both of them. This is a treat for Charlene being so good at the doctor's office. "You were very well behaved at the doctor's office so you get regular food this morning," Mommy told Charlene. The meal is brought in 10 minutes and enjoyed by Mommy and little girl. They draw some attention from other guests who find Charlene adorable. She is teased about needing diapers at her age by an older woman. All is well when the bill is paid and they return back home. Mommy has some things to tell Charlene and maybe it is best to get them out of the way. They sit in the living room with Charlene on Mommy's lap as she bottle feeds her cold water. "I have some news you will not like sweetie," Mommy said holding the bottle in Charlene's mouth. Dr. Black has a birth certificate that shows you are Charlene age 5 and still in diapers. The record shows Charlie has moved out of town to live with his father, Mommy continued to a very surprised Charlene. "I am raising you again from age 5 until adulthood as my daughter Charlene." "Mommy, that is not fair," Charlene said turning away from her bottle. "I am an adult male age 19 and don't care to start over." "You are Charlene, my little toddler girl age 5 and staying this way," Mommy insisted. "This has all been arranged legally sweetie. Any argument or misbehavior could lead to a spanking. Charlie is full grown and will remain this size as Charlene forever. In 13 years she will technically become an adult but will not be bigger. Mommy is keeping Charlene in diapers for the rest of her life at home." Mommy shoves the baby bottle back in Charlene's mouth making her drink up and be quiet. Mommy explains that after 13 years she hopes to have found a perfect woman to dominate Charlie as Charlene for the rest of his life. Mommy will always be part of his baby girl treatment. In a week Dr. Brown will have the small restrictive chastity device I ordered for you, Mommy said to Charlene's surprise. "I will bring you in, have her fit you in the device, lock it on tight, and give me the key." This shocks Charlie as Charlene. What else could possibly go wrong? He is a diapered toddler girl now and for the rest of his life. Even after getting married his wife will dominate Charlene with Mommy's help. That will be at least 13 years from now. "In a year I will start to homeschool you from the first grade up through high school," Mommy said with more bad news for Charlene. "You will never use the potty again and are already diaper dependent." Wow. This is all a shock to Charlene. What happened to being a toddler girl for just a year? That was bad enough. Charlie knows Mommy is serious about this. Being so small he will always be wearing cute toddler girl's clothing with diapers and plastic baby panties. "Mommy, you can't do this to me," Charlene exclaimed. "I don't want to be put in a chastity cage and remain a toddler girl forever. Take my diaper and these baby girls' clothes off of me." Charlie has lost control as Charlene after all the bad news. Talking back to Mommy this way is unacceptable. Mommy warns Charlene to behave and get used to being a toddler girl. The change is permanent for Charlie. Mommy hopes to find Charlene a wife later. Time passes with Charlie as Charlene's slowly getting used to being 5 years old again. After a while Charlie starts to like being Charlene. This pleases Mommy a lot and she can only smile. The end.